Hello, Silver Queens. Today, we'll delve into a topic essential for healthy aging: microbiome health. The microbiome refers to the community of microorganisms living in our body. In particular, the gut microbiome plays a crucial role in our health. The gut is home to approximately 100 trillion microorganisms, which is more than the number of cells in our body. These microorganisms significantly impact our digestion, immunity, and overall health. Recent studies have shown that a healthy microbiome exhibits high diversity and stability. According to research published in January 2025 by Professor Michael Snyder's team at Stanford University, each individual has a unique microbiome fingerprint, which remains relatively stable over time. This means that our genes, diet, and immune system all contribute to shaping this unique ecosystem. So, what efforts should we make for a healthy microbiome? First, a diverse diet is important. Professor Tim Spector of King's College, London recommends consuming over 30 different plant-based foods per week. It's good to eat a variety of fruits and vegetables of different colors. This is also known as eating the rainbow, as different colored foods provide different nutrients and dietary fiber. In fact, according to a report by the Korea Health Industry Development Institute published in December 2024, older adults aged 50 and over, who consumed a variety of plant-based foods, had 15% higher gut microbial diversity compared to those who did not. This suggests that eating a variety of vegetables is more important than simply eating a lot of vegetables. Second, enjoy fermented foods. Fermented foods such as yogurt, kefir, kimchi, and kombucha contain probiotics, which help promote the growth of beneficial bacteria in the gut. In particular, Korean kimchi is one of the world's most notable fermented foods. According to a study published in January 2025 by a research team from the Department of Food and Nutrition at Seoul National University, the proportion of beneficial bacteria in the gut increased by 25%. After 6 months in a group of adults over 60 who consumed 100 grams of kimchi daily. Third, increase your intake of prebiotics. Prebiotics are substances that serve as food for beneficial bacteria, mainly rich in dietary fiber. Bananas, onions, garlic, and asparagus are typical prebiotic foods. According to a study published in January 2025 in the American Journal of Nutrition, gut microbiome diversity significantly increased in a group of seniors over 65, who consumed more than 25 grams of dietary fiber per day. Fourth, reduce antibiotic use. It is best to refrain from using antibiotics unless necessary. Antibiotics can disrupt the balance of the gut microbiome because they kill beneficial bacteria, as well as harmful bacteria. According to a study presented at the European Society of Gastroenterology in September 2024, the gut microbiome recovery rate was twice as fast in a group that reduced unnecessary antibiotic use by 30%. Fifth, stress management and adequate sleep are also important. Stress and lack of sleep negatively affect the gut microbiome. In a study of 1,000 adults over 60, a research team from the University of Tokyo in Japan announced in February 2025 that the proportion of beneficial bacteria in the gut was 20% higher in the group who slept for more than 7 hours a day than in the group who did not. Sixth, exercise regularly. Moderate exercise helps increase the diversity of the gut microbiome. According to a study published in November 2024 in the American College of Sports Medicine Journal, gut microbiome diversity increased by 12% in a group of seniors in their 70s, who walked for 30 minutes or more at least 3 times a week. Seventh, avoid ultra-processed foods. Processed foods high in sugar, artificial sweeteners, and preservatives can promote the growth of harmful bacteria in the gut. In January 2025, a research team at the University of Oxford in the United Kingdom announced that gut microbiome health indicators improved by 35% in a middle-aged group that reduced ultra-processed food consumption by 50%. Eighth, enjoy coffee. Surprisingly, there are research results that coffee helps promote gut microbiome diversity. According to a study by the University of Milan in Italy in October 2024, Gut microbiome diversity was 18% higher in a group of adults over 55 who drank 3 to 4 cups of coffee a day than in a non-coffee drinking group. 9th, get regular microbiome testing. Recently, kits that allow you to easily test your microbiome at home have been released. From 2025, several insurance companies in the United States began supporting the cost of microbiome testing once a year for subscribers over the age of 50. This movement is also starting in Korea, and some large hospitals are planning to include microbiome testing as part of their health checkup items from the second half of 2025. Finally, if necessary, consult with a specialist to consider taking probiotic supplements. Not all probiotics have the same effect, so it is important to choose the right product for your gut health condition. In March 2025, the Korean Ministry of Food and Drug Safety announced the results of quality evaluations for more than 50 types of probiotic products and presented customized product selection guidelines for each age group. A healthy microbiome is closely related not only to digestive health but also to strengthening immunity, improving mental health, and preventing chronic diseases and overall health. In December 2024, the World Health Organization (WHO) issued guidelines for microbiome management for healthy aging and recommended that special attention be paid to microbiome health from the age of 50. Of particular note is the link between the microbiome and mental health. In January 2025, a research team at Harvard Medical School in the United States published the results of a large-scale study of 5,000 adults over the age of 65, in which the group with high gut microbiome diversity had a 30% lower risk of depression and anxiety disorders. This is important evidence showing the close relationship between the gut and the brain, called the gut-brain axis. In addition, the relationship between the microbiome and the immune system is also receiving attention, according to a study published in November 2024 in Nature Immunology. The effectiveness of the flu vaccine was 25% higher in a group of seniors over 70 with high gut microbiome diversity. This suggests that a healthy microbiome plays an important role in strengthening immunity in old age. The development of microbiome research is opening up a new horizon for personalized health management. In February 2025, a joint research team from Stanford University in the United States and Seoul National University in Korea announced the development of microbiome age measurement technology based on an individual's microbiome profile. This technology makes it possible to more accurately predict an individual's biological age and suggest customized health management plans accordingly. These research results clearly show the impact of the microbiome on healthy aging and longevity. However, microbiome research is still in its early stages, and caution is needed as exaggerated advertisements or unverified products are coming onto the market. In February 2025, the U.S. Food and Drug Administration (FDA) strengthened regulatory guidelines for microbiome-related products and urged consumers to be cautious of products with insufficient scientific evidence. Meanwhile, the development of microbiome research is also leading to the development of new treatments. In March 2025, a Korean pharmaceutical company announced positive results from a Phase 3 clinical trial of a microbiome-based immunotherapy for colon cancer patients. This treatment works by activating the immune system using specific beneficial bacteria and has been shown to increase the treatment effect by 40% when combined with existing anti-cancer drugs. In addition, the microbiome is playing an important role in aging research. In April 2025, a research team at the University of Tokyo in Japan analyzed the gut microbiome of centenarians and found that the proportion of specific beneficial bacteria was significantly higher than in ordinary elderly people. This study suggests that the secret to longevity lies in the diversity and balance of gut microorganisms. In particular, beneficial bacteria of the genera Bifidobacterium and Lactobacillus were prominently found in long-lived people. These beneficial bacteria play an important role in strengthening the immune system, reducing inflammation, and improving gut health. Studies have shown that people with a high proportion of these beneficial bacteria tend to have a lower risk of developing chronic diseases such as cardiovascular disease. In conclusion, a healthy microbiome is essential, not only for digestive health but also for maintaining overall health in the aging process. Therefore, it is important to maintain the balance of the microbiome for longevity and healthy aging. In conclusion, improving overall lifestyle habits such as a balanced diet, regular exercise, stress management, and adequate sleep is necessary for a healthy microbiome. It is also a good idea to check your microbiome status through regular checkups and seek expert advice if necessary. A healthy microbiome can be the key to healthy aging. Remember that your small lifestyle changes can bring big changes to the 100 trillion microorganisms in your body. This has been Silver Queens.